Hi guys, so today we'll be looking at strapping an ankle. The NBA season's just started and I've just put a Facebook post up talking about common basketball injuries. So we're going to do a 3-part series and today we're looking at ankle sprains. So obviously very common injury with basketball. What you're going to see most of the time is you're going to see people going over onto the ankle like that, so getting a sprain through what's called the ATFL ligament here. Okay. So obviously your RICE principles, rest, ice, compression, elevation, are very important within the first 2 to 3 days of a recent ankle injury. But what you might also find really beneficial is strapping the ankle up as well. So that's what we're going to do here today. So I've just started with an ankle already. And then what we're going to do, cut the strips to try and support that sprained ligament through there. Okay. Obviously, you probably want to come and visit your physio or your health professional just to rule out any other more severe injuries that you can often get with some sprains. But majority of the time, these are going to be the ones that we've got. So just make sure if you're strapping your ankle, you're getting someone to do it for you. You try not to have too many folds in the tape, and you get the person to hold their foot perfectly at 90 degrees like that. Okay. We're doing a couple of what's called stirrups just to support the ankle, try to minimise the movement, and then the next couple we put on after this are specific to try and really take the stress out of that ligament there. Okay, so that ligament stops your foot from doing that, rolling in like this, so we want to try and bring it up so that there's less of that happening. Just doing a bit of a figure of 6, that one's called. There's lots of different ways you can strap an ankle, but we're just trying to keep it nice and simple today. Perfect. And just anchor that one off to finish up. Good. The idea being, all of the directions that we've got that tape, we're really trying to minimise the movement going through this ankle on the right side, the outside here, just to try and support that ATFL. And that's one way to help with sprain for an ankle.